Ejaculating every day could be slowly killing you. Most men don't question their daily habits, especially the ones that seem natural. Ejaculation feels like one of those things harmless, maybe even healthy. But what if it was doing more than just providing temporary relief? What if, instead of helping, it was draining the very energy your body needs to stay strong? The effects aren't obvious at first, but over time they can quietly sabotage your overall health. Fatigue that won't go away, dizziness when you least expect it, and an immune system that seems to be failing you sound familiar? These aren't just signs of aging. They could be warnings. Your body wasn't designed to handle constant depletion without consequences. One man thought he was doing everything right, yet his harmless routine led him straight to a hospital bed. His story is a wake-up call every man should hear. John had always believed in staying active for good health. He exercised, ate well, and never missed his daily release, thinking it was essential for his prostate. But his body started to rebel. Unexplained exhaustion, blood pressure spikes, and an unsettling feeling in his chest. One night, after a seemingly normal release, everything changed. The pain hit fast and his world went black. What doctors discovered in his body left them speechless. And the truth is, he's not alone. Doctors rarely discuss this, and when they do, it's dismissed as perfectly normal. But emerging research is revealing something unsettling. Ejaculating too frequently might be putting your body under silent but severe stress. Every release isn't just about pleasure. It triggers hormonal fluctuations, weakens your nervous system, and forces your heart to work harder. The problem? This strain doesn't show immediate signs, making it easy to ignore until the damage is done. Over time, your body starts breaking down in ways you wouldn't expect. Testosterone drops, energy levels plummet, and your immune system weakens, leaving you vulnerable to serious conditions. Some studies even suggest a link between excessive ejaculation and a higher risk of heart attacks, especially in men over 50. Could something you've been doing for years without a second thought actually be cutting your life short? Most men don't ask this question until it's too late. John never questioned his habits until his health took a sharp decline. His case wasn't unique. Doctors are seeing more men suffering from unexplained heart issues, chronic fatigue, and nervous system imbalances. The culprit? Years of daily depletion, slowly eroding their bodies from the inside out. But the real danger isn't just what's happening now, it's what your body is silently warning you about. The signs are there, but are you paying attention? Your body never fails to send distress signals. It's just that most men don't recognize them. Maybe you've been feeling more tired than usual, struggling to focus, or experiencing random chest tightness. You chalk it up to stress, age, or just one of those days. But these aren't random occurrences. They're red flags warning you that something inside is off balance. The problem is, by the time most men acknowledge these symptoms, their health is already in serious decline. Think about it. When was the last time you truly felt energized, clear-headed, and physically strong? If you're constantly battling fatigue, struggling to recover after workouts, or getting sick more often, your body is screaming for help. And while you might assume it's just a normal part of aging, the truth is far more alarming. This slow breakdown could be linked to one simple habit you've been repeating daily without realizing the toll it's taking on your system. The worst part? Most men ignore these symptoms until their body forces them to stop. One minute, they're pushing through exhaustion. The next, they're in a hospital bed, wondering what went wrong. If you're experiencing unexplained fatigue, brain fog, or sudden health dips, now is the time to take action. If you are enjoying the video, please consider helping by clicking the like button and subscribing. It means a lot and motivates us to bring more quality content for you. Now let's continue. John was the kind of man others admired: disciplined, health conscious, always doing what he believed was best for his body. He exercised daily, ate clean, and followed the common belief that frequent release was essential for prostate health. On paper, he was doing everything right. But despite his efforts, something felt off. His energy plummeted, his heart would race unexpectedly, and his blood pressure became unpredictable. Doctors assured him it was just stress. But deep down, he knew something wasn't adding up. The warning signs kept piling up: fatigue that never faded, sudden dizzy spells, and a strange sense of weakness he couldn't shake. At first, he brushed them off, telling himself he just needed more rest. But then one night, after what should have been a routine moment of relief, John felt a sharp pain in his chest. Within seconds, he collapsed, gasping for air. His wife rushed to his side, panic setting in as he struggled to speak. This wasn't just exhaustion, this was his body finally giving out after years of silent depletion. When John woke up in the hospital, the doctors were baffled. His hormone levels were dangerously low, his nervous system overstimulated, and his body was in a state of extreme depletion. What shocked him the most was the cause: something so common, so ingrained in his routine, yet wreaking havoc on his health. And the worst part, his case wasn't unique. Men everywhere are unknowingly walking the same path, unaware of the silent danger lurking beneath their daily habits. John lay in the hospital bed, confused and weak, as doctors scrambled to stabilize him. His heart was struggling, his testosterone levels had plummeted, and his nervous system was overloaded. The culprit? Years of daily ejaculation had pushed his body into a chronic state of depletion. His body had been running on empty for so long that it finally forced him to stop violently. The doctors warned him that if he had waited any longer, the outcome could have been far worse. This wasn't just a fluke, it was a wake-up call. What really shook John was how common his case actually was. The doctors had seen it before: men who believed they were maintaining their health, only to find themselves in an emergency room, their bodies betraying them. The truth is, the strain on the nervous system, the constant hormonal crashes, and the silent toll on the heart are more widespread than anyone admits. But because it happens gradually, most men never connect the dots. By the time they do, the damage has already been done. John's experience serves as a brutal reminder. Just because something feels normal doesn't mean it's harmless. The body can only handle so much before it starts breaking down. And if you think this couldn't happen to you, consider this. How often do you feel completely drained after what should be a simple release? How many times have you ignored that lingering fatigue or random chest tightness? The real question is, how long until your body decides it's had enough? Now that you know the risks, the next step is understanding how to protect yourself. Experts are starting to rethink the old beliefs about ejaculation and male health, especially for aging men. The key isn't total abstinence, but moderation, giving your body time to recover and maintain hormonal balance. Some men have reported sharper focus, higher energy levels, and even improved heart health by simply reducing their frequency. It's not about deprivation. It's about control. Think of it like a bank account. You can't keep making withdrawals without replenishing your reserves. Your body needs time to rebuild testosterone, restore nervous system function, and maintain cardiovascular health. Cutting back just a few times a week could make a dramatic difference. Some experts suggest tracking your energy levels and experimenting with longer recovery periods. If you wake up feeling stronger, more alert, and less fatigued, you'll know you're on the right path. The real danger isn't in what you do today, but in what's building up over time. If your body has been sending warning signs: persistent exhaustion, weakened immunity, or heart palpitations, this is your chance to act before it's too late. The good news, your body is resilient. By making small changes now, you can regain vitality, extend your lifespan, and take back control of your health. But will you make the change, or will you wait for your own wake-up call? Now that you know the truth, what will you do with it? Will you keep ignoring the warning signs, pushing your body past its limits, hoping it won't catch up to you? Or will you take control, making smarter choices to protect your heart, hormones, and long-term vitality? The answer isn't about giving up pleasure, it's about finding balance before it's too late. Most men don't realize the cost of their habits until their body forces them to stop. But you have the chance to act now before it's too late. Think about it. How much energy, strength, and focus have you lost without even realizing it? Have you been feeling more fatigued, struggling with low motivation, or noticing unexpected dips in your health? These aren't just random issues. Your body is constantly sending signals, but are you listening? The good news is that small changes can lead to massive improvements. The question is, are you ready to make those changes before it's too late? If you found this information valuable, subscribe to the channel and turn on notifications so you never miss critical insights about your health. And before you go, watch the video appearing on the screen right now. It can help you improve your sexual health. Click on it,